Today I'm going to go over a little bit about shoulder and shoulder arthritis. And I'm going to do a little bit of an anatomy lesson, very basic though. So here is our shoulder joint right here. So this guy here is our humerus, and that is our arm bone. And then here, this guy here is our shoulder blade or scapula, and this is our clavicle, and that is the part that sticks out right in the front there. So this humerus goes right into this socket. This socket here is the glenoid, okay? In the glenoid, we have something called a labrum, and the labrum pretty much is the cartilage of our shoulder joint, almost like the meniscus of your knee. So if anybody's ever heard about the meniscus is that cushioning between the joint of the knee. It's the same thing with the labrum. Labrum is here to cushion the shoulder joint and allow for mobility of this humerus in the socket there, and that's how our arm moves in all those crazy wacky directions. True fact is that the greatest range of motion of any joint in our entire body is found in our shoulder. Just think about it. You know, you have to move your shoulder up, you move your shoulder back, you move them out to the side, and you even rotate it in and out. It's pretty complicated. So what other things besides the joint itself and these bones encompass the shoulder joint? So the biggest thing is the rotator cuff, and the rotator cuff is made of 4 main muscles that originate actually on your scapula. So everybody's like, oh, but my pain is here. But the thing is, the actual muscles originate from back here. So this is looking at the back of the shoulder blade area. So we have a muscle here, we have several muscles here, and then we also have a rotator cuff muscle on the inside of the shoulder blade. So all these muscles together insert onto your shoulder humerus bone here. And they're imperative because without any of those shoulder rotator cuff muscles, you wouldn't be able to do lots of activities with your shoulder. So the biggest thing is rotator cuff muscles provide the stability in your shoulder and allow your shoulder to move in all those different directions. And when something goes wrong with those muscles, then you have pain, range of motion problems, and you can't do some of the basic activities that you normally do, like getting dressed, showering, washing your hair, all those kinds of things. So how does PT help exactly? We cannot change the structure of your actual bone, but the thing is that you want to actually work on strengthening everything around the joint where the bone and the bone are together. So if you strengthen everything around the joint, you're giving it a good stability area so that all these muscles will be strong, take the support of the joint, make it stronger, and it's going to take the brunt of the force away from the actual bone and the other bone. So the thing is that we're working to try to eliminate the pain that is induced in the joint by strengthening all those muscles, and that's what the rotator cuff does. The rotator cuff muscles are usually pretty weak because people don't normally strengthen those smaller muscle groups. People will focus a lot on your deltoids and doing arm raises, front raises, all those kinds of things, biceps, but they forget about the small rotator muscles. So it's pretty common when we see patients, they think they are super strong, but when we check their rotator cuff muscles, some of the smaller muscles, they're noticeably weak. So it's something that we can work on. So besides working on strengthening of that rotator cuff, we want to work on some posture. It's pretty common that when these muscles where your rotator cuff are, they attach here, these muscles are weak, you notice the shoulders kind of round forward like that, and that's because these are weak and your pec muscles here are tight. So we want to stretch out your pec muscles, we want to strengthen the back of your shoulder where all those rotator cuff muscles are, and what that's going to do is it's going to take this guy from being all the way here and pulling it back into the center of the joint, and that's going to improve your ability to actually move the shoulder joint because it's back in the center. This bone should technically be centered in this joint. So when you're having issues with the rotator cuff muscles being weak, typically you will notice worse posturing, more forwarding movement of the shoulder here, rolling forward. And so part of the issue is trying to strengthen and work on posture and strengthening of those rotator cuff muscles so the mechanics of this joint are correct, and that will also bring you less pain. The other thing that PT does is that we can actually move your arm and work on things that you can't do on your own. So what we do is a lot of joint mobility, where we actually get our hands on the joint and we actually move them in ways to improve the mobility of that arm bone on that shoulder so that you can increase the range of motion. The other thing is some soft tissue restrictions. Like I said, if you have some pain from having a tight pec muscle, sometimes people get some tightness in the back here, we can dig in there and get that out for you so that you can tolerate the exercises better, and then get to the point where you're not having soft tissue restrictions. Big thing with PT is to focus on function. So everybody thinks, oh, getting dressed, being able to shower, all those things, yes, super important. And the more you neglect the pain, the worse those normal everyday activities get. The key is that we also want to get you back to your full functioning, whether it's running, swimming is a huge one because of the shoulder. We don't want to just stop at your normal everyday activities of daily living. We want to actually get you back to the full function of what you were doing before, so that we are the guys that actually can get you to do those things with a lot less pain or even pain-free. So like I said, if you do not address this now, you will start to lose more and more range of motion in all the different directions. Like I said, the shoulder is the most mobile joint of your entire body. So when you can't have the use of your arm to do basic things like getting dressed and washing your hair, it's going to get pretty frustrating. So if you keep waiting, the longer you wait, the worse it's going to get. Also, sleeping at night becomes an issue where you won't even be able to sleep on your shoulder, let alone even sleeping on your back might be painful. Obviously, if you do not do anything, you will have to resort to what is the last resort, which is surgery. And with surgery, that could be anything from the doctor going in with a scope and cleaning out all the arthritis in the joint, and other things such as if there are spurring, that might tear away at some of the tendons from the rotator cuff. So we're talking like basic surgery, which is just debriding the area of the space of arthritis, and then if it's bad enough, tearing some of those rotator cuff tendons, which then is a significant surgery, which is several months of rehab involved after that. So it's really important, if you're having pain, give us a call and let us know, and we can get you in for an evaluation.